See applied behavior analysis in a different and refreshing light here at the Skinner Report. Hosted by Sara Litvak and Anna Bullard. They shed light on what ABA therapy organizations need to know to level up their behavioral health services, helping every individual with autism meet their maximum potential. Join information-filled episodes with leading industry experts as they discuss every issue and update in the ABA scene, giving you an idea of what you can do to become a quality ABA organization and support the building of inclusive and comfortable workplaces in this side of the healthcare world. Here are your hosts, Sara and Anna.
Hey, Anna, we're doing a podcast.
I'm so excited.
It's going to be fun. So I am excited to chat about all things ABA, what's going on in the industry, what are some exciting BHCOE updates, policy updates. We have so much to cover. And Anna, since we have you here, I wanted to just quickly talk to you a little bit about any of the updates you have for us legislatively and advocacy related coming into the new year. So I have a couple states I'm hoping we could talk about. We got Texas, we got Georgia, North Carolina. We have some changes happening at the federal level. So why don't we just dive in? Tell us about what's going on in Texas.
Yeah, I mean, so much has been happening in Texas over the last few years. Everyone has been waiting on the Medicaid benefit to roll out. And so there's finally money in the budget, but then the fee schedule came out and was basically not sustainable. A $30 an hour RBT rate, as everyone knows, is just not something providers can do. And especially in the market that we're seeing now. I mean, right, Sara? I mean, we just released a report about that. And so in Texas, we have seen a lot of advocacy, and the efforts of that have paid off. That resulted in a rate increase to 45. That's for the RBT. And that puts Texas in line with some other states. Florida is a good comparison. I think they're at 47 for an RBT, 47 and some change. So there's some exciting movement. I did hear a rumor that there's an additional dollar increase on that RBT. So I can't say that I know it for sure, but it is a rumor that seems like it may come to fruition, which would be incredible. I know for a fact that the MCOs are pushing back hard just because they don't have the network adequacy. So we're excited about all the providers that are really fighting for families there.
Amazing. What's going on in Georgia?
That's my home state. So,
for those of you who don't know Anna, there's a law that's called Ava's Law. That's named after her daughter, Ava. And Anna is a proud mom of a daughter with autism, and she fiercely advocated for the autism mandate in Georgia. So that's the namesake Ava's known for.
Yeah, it's really hard sometimes for me. I know providers who come into the state, they have problems and issues, and there's things that happen and they get frustrated very quickly. But for me, working for the Medicaid benefit almost 10 years, I take a step back every time and I'm still like, but we have the benefit. I'm like, but we have the benefit, which I know is not good enough, but still, I'm just like, we have the benefit, guys.
Not only do you have the benefits, some of the best rates, right?
Exactly.
Yeah. So Sara, you have the benefit and amazing rates.
Great point, Sara. I mean, it's like some of the highest rates in the nation comparable to Massachusetts and North Carolina. I feel like we have a lot to lean into. But we've had a lot of influx of providers, which has been incredible to really see access tick up. And we're seeing some providers face denials, some consistency in the diagnostic criteria. But thankfully, the work that I'm doing with government relations at BHCOE, it allows us to be able to really aggregate the information and see the trends across hundreds of providers. We're not just talking about an isolated incident. I think that's one of the benefits we have, right, to what we do, is we can really start to look at, is this really a one provider issue, or is this truly a trend across the state? So we've got some of that happening as what I would consider a trend with those denials. And we actually are working with Medicaid on that. I think it's like anything. We've only had this benefit for a couple of years, and then COVID hit. And so I think it's in the beginning phases of really working out the kinks of a benefit. But I think Georgia has a lot going for it. And I still think it's a very exciting state to come into. And there's still a lot of kids who need services.
Anything related to licensure we should be aware of?
Thanks for bringing that up. Just it's all about tone, right? So yeah, thanks for bringing that up. It's licensure is interesting in Georgia because I think for sure, I mean, BCBAs across the state, I know they want a licensure, and I certainly understand that. One of my really dear friends, Dr. Michael Morier at Emory, he really feels like it's important, and he's been working in the field, gosh, for a very long time. And I do understand the value in it. My concern is other licensures that we've seen pass, whether they were BCBA licensures or maybe licensures like in Pennsylvania, where it has a broader stroke and it doesn't just include BCBAs. There are always risks. And in Georgia, I did voice that concern. And sure enough, we faced one of those risks head on. And it's an issue now, not just a risk. It was a recommendation. My understanding was through the psychologist that RBTs be included in that licensure. And the committee accepted the recommendation, which again was very abnormal in that process. And so now we have to get that removed. The bill will go, we haven't even started session yet, but there's definite concerns with that. I mean, RBTs don't need to be licensed, and you don't bill under the RBT, and BCBS. I mean, I'm preaching to the choir.
It's also huge, like a barrier to access to care too, because it's already so burdensome to get folks in the door, and then you have to wait for them to get licensed. It's another delay. And the RBT, as we all know, is kind of a fleeting role. The turnover rate is quite high. So it just seems like it's undue burden on the provider to try and get care provided.
You're exactly right. I know you're very familiar with the data that we've seen, probably much more than me as far as that turnover goes, but it's high, right? And so you're talking about licensing an entry-level position, and it's just very burdensome. You're exactly right. So I think it can be resolved, but I do think there's concern. And really the primary issue when I spoke to Representative Dempsey, who ironically, she was one of the first representatives to sign on to Avis law. So she and I have known each other for, 16 years now. I met with her, went up to see her in her office, and she said, hey, I don't want this for the RBTs either, but the BCBA licensure is really, because we have some concerns about the providers delivering, some of the providers delivering care. We want to make sure we just know who's here and what's going on. So I understand that. I think there's always an importance in consumer protection, but I just think we have to be very careful, right? I mean, Sara, we know about the issue in Arizona. We hear that from our accredited providers. It's taking 6 months to get licensed there. Yeah. So I just think we have to be careful with licensure. The intent is good, but I think it can very adversely affect access to care, which is already one of our primary issues in the field.
Yeah, absolutely. North Carolina has been an interesting one for us to watch. Also, for those of you who are familiar with North Carolina, they've historically required a licensed clinical psychologist to oversee or kind of go over the BCBA for them to be able to provide care. Anna, tell us a little bit about some of the evolution we've seen in North Carolina and some of the movement that's happening there.
Yeah, it's interesting in North Carolina because, as you know, there are not a lot of providers like we see in neighboring states, Georgia, South Carolina, even Kentucky, right? I mean, just there's so few providers in comparison to the number of children with autism. And I think that's primarily been to the Practice Act and BCBAs not being able to practice. I mean, I think you and I have talked to some of these larger providers looking at expansion, and I think that Practice Act has really deterred them in a lot of ways. And so that legislation that was passed would allow a board to be created and a licensure for BCBA so that they can practice independently. I spoke to a practitioner in North Carolina when you and I were at a conference, and his thoughts to me were, it's a very slow process right now in them putting together the board. So the legislation does take effect in January. However, there hasn't been a lot of movement to date. So it's going to be interesting. I think providers are treading very carefully because if the board is not formed and they actually can't get a license, they still have to abide under that Practice Act. And so I think that's really what we're trying to convey to our accredited providers who are asking questions, and just the field is, I mean, technically you would still need to abide by that until you can become licensed yourself. So it is a slow moving process.
We'll definitely keep monitoring that for all of you concerned. And we've already seen some movement into the state because of this pending movement. So the good news is that I think more providers will enter the state once this is in line. But for those who've moved in hopes of this, it may take a little longer than we hoped. So I want to talk about some of the changes at the federal level, but I'm laughing only because by the time anyone listens to this, it likely won't be correct anymore. The changes seem like they're happening so quickly, especially with COVID and all the different updates happening at the Omicron level. Anna, do you want to give us a quick update federally about kind of the state of emergency and understanding like what does that mean and continued coverage of telehealth? Where are we at? And no, my disclaimer is none of this will probably be accurate, probably tomorrow even.
Oh my God, you're so right. Because we had our second webinar on really just, we had experts, attorney experts that were brought in, and it was really fantastic. And their focus was really on looking at kind of the halt on what the Department of Labor mandate was about. Like if you have more than 100 employees, right? But still the CMS mandate was in place that no states had, I guess, from the court side had put any action into play. But literally, it felt like we blinked. And then there was all the rulings from different courts that halted the CMS mandate. It's so challenging. I mean, I get text messages all the time from providers asking, do we have to comply or do we not? Right. And I think I'm certainly no attorney, so I'm not going to say yes or no. That's a very tough decision that thankfully I'm not making. But I think it's just so many moving pieces to this. I know a lot of providers who have just decided that they're moving forward, I guess, with the original legislation just because it's too difficult to ebb and flow through the yes, you do, the no, you don't type stuff. I think it's so challenging. I mean, what's your perspective, Sara, from what you're hearing from everyone, just trying to maneuver through the you do have to comply, you don't?
I think it's such a personal decision because I think on one hand, like you said, federally, there's certain guidance. And then I think what we found throughout the entire pandemic is states have kind of taken to their own in terms of their own interpretations. And part of that is what makes this country great, right? Is that you have these federal mandates or federal ideas that come down and then states can kind of do what they want with it. And I think each presidency has treated states, I guess, autonomy very differently. So to me, it's been really interesting to see how the states have been responding. And, like you said, there's been a couple states who kind of say, we're not worrying too much about COVID safety. We're not worrying as much about vaccine requirements. There's some where telehealth was pretty widely used even before the pandemic. So I think on the provider end, I say that more so just to say it comes down to risk tolerance, I think on both ends. And this is just the decision I'm sure every CEO is having to make is kind of what level of risk tolerance are they comfortable with? And I know if you're taking Medicaid dollars, you don't really have a choice, right? You kind of have to follow some of those conditions to receive those Medicaid funds. But if you're not, that's where you get to be a little bit more flexible. But we can't talk about all this without talking about the extreme labor shortage that everyone is experiencing. And understanding that if you are in a state where people are more hesitant to follow some of those safety measures, what are the implications on your ability to have a workforce to service your patients? So I guess there's no clear and easy answer. It's something that I think every business is trying to navigate right now.
Yeah, I think that's so true. And I think that's the perfect way to put it. What is your risk tolerance? And I asked one of the larger provider that is accredited, I just said, is this wavering on the vaccine mandate, is that causing issues for you state to state? And their feedback was, I mean, of course it is, but they're just having to make decisions for their company. It's too difficult to try to do one thing in this state and another thing in this state. And that becomes very challenging in and of itself just to maintain all that. But I don't know that providers have really experienced the type of labor shortage. I mean, it's always been difficult on the BCBA side in certain areas, obviously more than others. But I think the RBT challenge is really, really impacting access to care right now, which is very sad, right? Because this is what we know is that based on the data, we hear that there is such an increase in need of behavioral health on a national level. And I just think about all our families with children with autism and how much more they need stability in their life now more than ever.
Yeah, absolutely. To kind of close the loop on some of this, I would say if you're listening to this and you're trying to figure out what to do, everyone's with you. There's definitely a lot of moving parts to consider. And I think ultimately, we've been trying to provide as much information as possible to organizations like you so you can make the best choice for your business, your employees, your team, and really go from there. So, all right, everyone's favorite state, the Big Apple, city that doesn't sleep, New York. I want to talk about only because I feel like every time I bring up New York, everyone just shudders because I think we all know New York has had one of the most challenging laws when it comes to licensure that's really just on a larger scale and inhibited the ability for behavior analysts to practice. It's also kind of slowed the ability for ABA providers to really enter into the state or be essential into the state. And the state is really dominated by a couple large providers that have been able to make it work over the years. But
I do have Debbie Napolitano herself.
Oh my gosh.
From New York State ABA here with us. Hey, Debbie.
Hey, how are you?
I'm good. Thank you so much for joining us. I'm so excited to chat with you because you guys have had such an amazing win lately in New York. And so Anna and I were just chatting about all things legislation. And we just thought if you were available, you could come in and just tell us in your own words a little bit of the win that you guys just experienced in New York.
Sure. It's kind of surreal. We spent 5 years on this bill. As most people know who have experience in New York, and many others also know, we were restricted to only practicing with individuals with autism in New York. And it's caused a lot of actually expected problems, but they've gotten pretty bad over the years in terms of really making it difficult for people to move to New York because their experience hours might not be only with persons with autism. And so their hours weren't counted towards getting their license and they may have to start over. There's many other things I could go on all day about some of the issues that it caused, but we wanted to really try and get our license closer to the rest of the country. It's not perfect, but after 5 years, we were successful.
Wow. That is amazing. And if I remember correctly, the New York governor had threatened to veto the bill like just a week or two ago. So tell us a little bit what happened there, because I know, like you said, it's been a 5-year struggle, and then we got there and we were very optimistic. And I know, you know, Anna and we were all sending letter. I mean, everyone was kind of rallying behind this. So what happened?
None of this happened in a vacuum. I could go through hundreds of things, including some of what you just described, people sending letters and all of the support that we got that are the reasons why it actually crossed the finish line. We had back in May, when we finally got the word that it was going to go up for a vote on the committees, the professions committees, which really our biggest hurdle for most of that time, we were elated because that's a very difficult thing to do in New York. And when other professions found out, they really hadn't been paying attention because there was a high likelihood that it was just never going to make it to committee. So it was a very last minute thing, but there was a very strong effort to stop the bill right before it was voted on, actually on the Senate floor, which was our last hurdle to get it passed. And those same groups throughout the period of time between the time it was passed and the time the governor signed it had mounted a pretty similar campaign towards trying to get the bill vetoed. The biggest reason that was cited ultimately was that it was going to cost Medicaid $82 million to sign the bill. But we were able to, given all of the various ways we were able to make the case for this bill and have support coming from many, many different directions to convince the governor why this was important. In the face of that, we were able to debunk the 82 million issue with some pretty good data analysis of just capacity in New York. And that was, I think that ultimately when they couldn't stand that one up anymore, and with every way we were able to get support from a lot of unlikely places and some likely, I think it finally got to the point where the governor realized it was needing to be signed. And we couldn't have been more lucky with our sponsors. I mean, their efforts at the very end, it is sausage making, and I don't even know what they probably gave up to get this. So it was pretty amazing.
Well, thank you so much for jumping on and chatting with us for a few minutes. I know that we've all been following with bated breath, and it's such great news. And I'm very hopeful that this will increase coverage and access for a lot of the kids and adults with autism in New York.
Me too. I think what's really important to note is that we were only able to get it to, the bill actually says any diagnosis in the DSM. So it's not an equivalent bill to the rest of the country. There still will be some quirks to it. You still need a prescription, and we have 18 months of rulemaking. So I've heard from a lot of people, can I just use my BCBA now and get my license? And that's never going to happen in New York. And then it's just important to note that we have some time that it's going to take for the rules to be developed. So, but it's done. So we now are able to work on that. So,
yeah, absolutely. Well, thank you again. And
no problem. Thank you for having me.
Getting any
Congratulations, Debbie.
Yeah, congratulations.
Oh my gosh.
Thank you. Thank you so much. Thank you. We really appreciate it. And I appreciate all of your support.
Sure thing.
Anytime.
Yeah. Thanks. Take care.
Thanks, Debbie.
Thanks. Bye.
You know, Sara, it's so interesting. A couple things I learned just from advocacy for so many years. You have to have a champion, which is what she's saying. I mean, you have to have that person that usually is connected to leadership or in leadership themselves. And you have to persevere even till the bottom of the ninth, last up at bat. I mean, that's just, you can't give up, which they didn't, which is how they got it across the finish line. But the sausage making is true. I mean, when we passed Davis Law, it was amazing to me, all of the trades and deal makings that had to occur behind closed doors to get us to where we needed to be. It's a real thing. So yeah, congratulations to them though, for not giving up and getting it across the finish line.
I couldn't agree more. And look, there's still a lot of work to be done. New York, as you know, is one of the 2 states that doesn't have Medicaid. I mean, there's so much that still needs to be done in the state and across the US, but it was a very good non-example of what we don't want to see happen across a lot of the states that we work in. So let's talk a little bit about North Carolina, going down a little south. And I know this is another one when we talk about ease of doing business, like we were talking about with Georgia. For those of you who aren't familiar, North Carolina largely had some limiting requirements in the sense that they required that BCBAs were supervised by licensed clinical psychologists at one point. And so some of that has been repealed. But tell us a little bit about what's going on in North Carolina right now, Anna.
Yeah, it's been such an interesting state to watch because they were working on coverage the same time I was working in Georgia. So I met a lot of families. They were able to get their insurance mandate passed, and they have a Medicaid benefit, but that benefit, as you said, has been restricted through the Practice Act, which is that a BCBA has to be supervised by a licensed psychologist. And so the bill that was passed this past year would allow BCBAs to practice on their own. And a board has yet to be formed. So that bill is actually law now in January, but BCBAs still, you need to know that they technically can't practice independently because they can't yet be licensed. So similar to what Debbie's talking about in New York, I mean, there's the other piece that I think is so important to advocacy is really when you get your bill passed, the hard work begins because implementation of legislation is so hard. And I think that's why in many cases things don't come to fruition in ways that they should, because you've got to have people behind that implementation. So I know there's a lot of people working in North Carolina, and I understand that some members of the board, hopefully maybe all of them have been appointed now, but I also talked to a provider there that said that it's going to be very costly and there has to be an organization that is footing that bill, and the cost that it's going to take, they don't have the money yet for that. And they're working on that. And so I think that it's just a work in progress. But I know there's a lot of providers who are really waiting to serve kids there. They have surprisingly such a low number of BCBAs in that state in comparison to their neighboring states, just strictly because of this Practice Act issue. But I feel really hopeful that the needle is moving there and that BCBAs will be able to practice independently, hopefully very soon. But it doesn't look like it's going to be within the next few months, just realistically. And we certainly want people to know just because it's January, you can't just practice.
Right. We'll continue monitoring this and we'll share updates as they come up. So definitely stay tuned for any changes to that. But that's a good thing for BCBs to be aware of. All right, we're at Oregon and Texas, and then we're going to do a quick international update. So in Oregon, the Oregon Health Plan Medicaid Department is requiring, or I guess requesting CMS to renew their waiver. Tell us a little bit about the demonstration that the waiver covers and how that applies to the EPSDT benefit.
Yeah, it's really so bizarre. So I was not aware that you could receive an exemption from EPSDT benefits. And I really would say, in technicality, I don't think you can, but Oregon did. And it's called the 1115 demonstration. And it was for them to be exempt from EPSDT benefits, which autism is included in that. But that's early periodic screening diagnostic treatment is what that stands for. And so that includes really all medically necessary treatment that kids are receiving through Medicaid. And they received that exemption, and then it was renewed, and now it's up for renewal again. And it's shocking to me, Sarah. I mean, honestly, I'm just really surprised and am thinking that I just want to go like with a microphone that where all of the citizens of Oregon can hear. I'm sure a lot of people do, and just be like, hey, what is going on? Because it's so discriminatory in so many ways. So that's why the Disability Rights Organization is really taking this up. There's a letter that we signed that other people can sign in response to this request to be exempt. And Sarah, the worst part is it's asking to be exempt for cost-effective purposes.
Interesting.
Right?
I mean, I feel like it's a consistent battle between federal requirements and state requirements for a lot of these as well. And I think that's one of the things that is really unique about the United States, but also kind of poses some challenges, is that there's these federal mandates that come about, but then states kind of want to do their own thing. So it'll be interesting to monitor this. And it always comes down to budget, it feels like, in these decisions.
Right. I mean, which is why EPSDT benefits are in place, because those benefits are in place to say to every single state, whatever your budget looks like, at a minimum, you have to be covering EPSDT. Like, you can cut other things, but you can't cut EPSDT benefits, right? And so that's the purpose of EPSDT, right? I mean, it's so that they can't do this. I was so shocked when I was reading some of the documents on this. And just the other issue is they do use a quality adjusted life year, which is just another huge way to discriminate individuals with disabilities. So there's also some work being done to eliminate or to remove that quality adjusted life year discrimination. I don't understand that completely, just Sarah, to be honest, but in a nutshell, what I do understand is that for someone who has, like me, who has a child with autism, I mean, they're taking into account disabilities and using that to make determinations of who gets services longer. You know, it'd be interesting to have somebody really explain that, but I've never heard of such a discriminatory metric as long as I've been doing this. And I didn't realize that Oregon was still using that. And there's some other things related to suicide prevention that are in there too. So I think there's a lot going on in Oregon. I really feel like that they have a long way to go, but hopefully CMS will just deny their request, right? I mean, that's the hope.
Right. Look, I'm not a betting woman, but I would guess that'll likely be the case. So let's all cross our fingers on
that.
Exactly. Texas has been a huge topic, I would just say nationally. So I know what I'll say is a lot of organizations are looking at where do they want to expand into, and Texas seems like a good place to go, mostly because it's a high population. There's a lot of BCBAs there. There's a lot of individuals who have not been served. And not only that, there's a number of individuals who haven't been served because Medicaid has never been rolled out. The ABA benefit has never rolled out. And so, Anna, you have been following this very, very closely, and we do have a lot of movement on it. And from what I understand, the Medicaid benefit is scheduled to roll out. There has been a lot of pushing back as to when that's happening, and it is going to be a managed care benefit. So the MCOs are going to be overseeing the benefit. So talk to us a little bit about where we're at in the Medicaid rollout in Texas, and then what we're seeing across with rates as well.
Yeah, you bring up such all the right points, right? I mean, it's about network adequacy, and that is obviously tied to the rates. And I know providers get frustrated because when they have to talk about rates all the time, it starts to feel like a bad look for them. But at the end of the day, the issue really is if you have a commercial benefit, and Texas has had a commercial benefit since I think '08, either '08 or '09. So, I mean, a very long time, a very robust benefit. And all the providers obviously have been building their network adequacy with RBTs and BCBAs based on those rates. And not that anyone expects Medicaid to be awesome, but it has to come in line close to your commercial rates, because otherwise you're not going to be able to hire any staff. You certainly can't bring staff in and say, we're going to pay you a lower rate just to work with Medicaid kids. You can't do that. So they set the rate at $30 an hour. And there was thankfully this huge push, same as like in New York, couple really strong champions, and they raised the rate to $45 an hour. This has just been in the last few months. I did hear that there is discussion of another rate increase, but Sara, I haven't had confirmation on that. That hasn't been released publicly or said anything. No one has said that. This other rate increase came pretty quickly in response to really just no network adequacy from the MCOs. But I think the MCOs are key in getting this rate where it needs to be. And I don't feel like providers are wrong in really pushing on this to say we've got to be able to hire staff. We've got to be able to pay staff what we're paying them. And, you know, it goes back to exactly what we keep talking about. I mean, the market shortage is certainly not helping. So the benefit rollout technically is February, but the MCOs are saying we don't have providers in our network to serve kids.
Mm-hmm.
So that's really where we are.
That kind of pushed that rate increase to begin with is just no one was really enrolling to be a provider. So
that's right.
I think that experiencing that same thing will hopefully help push those rates up just a touch as well. I will say, I know BHCOE, we've been working really closely with HHSC and the MCOs, and they are very responsive and really do want to do the right thing and make sure that the kids have the care that's needed. And so it's been nice to see how responsive they've been to these things. And we'll certainly keep everyone up to date if we hear anything change from what we know about the current rates. So bring it home with Canada. Oh, Canada, Anna, what's going on in Canada? I will say, I'll just caveat by saying Canada has been an interesting case study, I guess, in terms of applied behavior analysis, our neighbors in the north. I know that Ontario ABA has been very active in advocating for the need for applied behavior analysis, but the different provinces really have limited coverage across how much care children can receive. So fill us in about any updates that Canada has had in the last couple months.
Yeah. So we have a couple of accredited providers who came to us to say, hey, we could really use some help with research and just anything that we could offer them from BHCOE on the efficacy of applied behavior analysis, and then also on who should be delivering that service, who is qualified to deliver ABA to children with autism. So, I was able to get some education from those providers and really understanding what the benefit looked like there. And surprisingly, Canada is a place where they have a state-funded healthcare system, and that ABA and coverage for autism is not a covered benefit, which is, I don't know why I'm shocked. I don't know why I'm still shocked 15, 16 years later. I'm just like, what? And in some ways, I've always thought of Canada as having a more progressive healthcare system, and I don't live there. So I guess maybe they do in some ways. It would be interesting to maybe hear from someone who does live there. But so they don't include autism coverage for ABA in their just general healthcare benefits. It's done through a separate funding, and it's only through the age of 6. And when we think about the average age of diagnosis, I mean, obviously in here from the CDC, it's usually 4.3 or, 4 years. So that's just the scientific average when you look at the CDC numbers. So some states are doing better than that. So it's interesting when you think about kids being diagnosed later and accessing that service, and then it only being available through the age of 6. And then there is a cap of $22,000 a year. And when I think about a child who does need early intervention services, and $22,000 a year is not really going to go that far. So the system seems to be, it has something there, but certainly not what I would consider benefit that could really be effective for kids with autism. And then I just think about all those kids that are diagnosed after 6. And the other issue is they're looking to change the benefit. The existing benefit that they have is looking to be changed in a way that many of the providers feel like could create issues for children with autism accessing the care that they are currently getting. And then they also do allow others beyond BCBAs to practice applied behavior analysis. And so we see that in many states where obviously a BCBA or a licensed psychologist, but there is some concern when you have a broader stroke and it's not specified that they need training in the field of applied behavior analysis and be a licensed physician or BCBA. There's a couple of other states that have that kind of, actually, that's the way their license is written. Pennsylvania is a great example. So you can be licensed as licensed behavior specialist for Medicaid and deliver ABA without being a BCBA. So anyway, it's an interesting opportunity for us to provide support, to provide expertise with Dr. Kasemi and her team to really try to help kids access care. And they're really just at the very beginning of really treading through the mire and the muck here of figuring out what to do, how to do it, how to work collaboratively together. Yeah, so there's a lot to do there, I think, and a lot of support that we all need to give to Canada.
Anna, did you have anything else you want to add about Georgia?
Yes. So the little nugget that I have for everyone for Georgia is that they are updating the manual. So it's going to be updated, I actually think just this month. It'll come out with real clear guidance on what diagnosticians need in order to comply with the Medicaid manual. And that is an assessment tool that is conducted by them. It's their choice what they use. They do provide a list, but that is just a list. And then there has to be a parent reported, help me, Sarah, what's the word? Assessment.
Yeah.
We talk about this stuff all the time, but parent reported measure. Yeah. So like the Vineland 3.
Okay. So a parent reported. Yeah.
That's right. So those two things have to exist. And so what Medicaid is saying that is if you get a denial because one of those two things are not present, you can and should request back to your reviewer an extension. So just to say, these things don't exist. They were not done by the diagnosing physician, and request that your authorization be approved for the next 6 months and that you will work with the family and the diagnostician to get those things done by the next authorization period. Because the issue is that the diagnostician they're not complying with the requirements that the Department of Medicaid has put in place for ABA. And the other, I think, little nugget that is important is Medicaid did say that there are, I think, some providers in just trying to compensate are doing things where they're saying ADOS, like saying that the ADOS score is 0, or they're mentioning assessments to say, I think they're meaning to say the assessment wasn't done, like the diagnostician didn't use this assessment. But that is causing confusion with the reviewers and them thinking that the assessment was done, but the score is missing. So the clarity that I think is important is just to say, whatever the diagnostician did, just put that, be very clear about where the scores are in that. And if there's not a parent reported assessment done, then you need to tell them that you will do that by the next auth period. I'm hoping that's going to fix some of these issues. I mean, we're seeing hundreds of denials at this point. And so I hope that's going to fix the issues. I hope for anyone listening that that's going to help you out. Obviously, give us a call if you need help with that. But at the core of what we're dealing with is this is something that I feel like has to be worked out with those diagnosing physicians. ABA providers can't do anything.
Well, thank you so much, Anna. This was so insightful. We are going to be covering legislative topics like these as they come up. So check back weekly for new episodes. And we're so excited to continue to update you as things come along. Thanks so much, Anna.
Thank you.
All right. Up next, we have Jon Krieger with Calex, who's going to be talking to us a little bit about mergers and acquisitions in behavioral health. Calyx is an M&A advisory firm located in New York City. They're exclusively focused on healthcare services with a strong focus in behavioral health. And Jon and his team have advised clients in over $2.5 billion worth of transaction value over the last several years in the autism behavioral health space alone, including the Ontario Teachers Union acquisition of Acorn, Blackstone's acquisition of Card, General Atlantic's acquisition of ACES, Griffin's acquisition of Learn, Audax acquisition of Proud Moments, and FFL's acquisition of Autism Learning Partners. Without further ado, I am here to bring you Jon Krieger from Calex Partners.
Thank you, Sara. Thanks for having me, and thanks for those kind words.
Sure. So the reason that I asked to chat with you today is just because when anyone thinks about transactions in the ABA space, your name comes up, most notably because you really advised one of the largest deals in applied behavior analysis was the Card Blackstone deal. And I guess I just wanted to ask you, I mean, that was a couple years back now. What have we seen in 2021? So the year prior, we're kind of in the new year at this point. What happened last year? What are some of the notable transactions that happened? How did they fare with COVID? What are you seeing in the market?
Sure. So look, I think so there were some notable transactions in 2021. Obviously, the market, like most businesses in the economy, multi-site businesses in particular, was heavily impacted by COVID and then later in the year with labor and supply issues. But nonetheless, there were still some notable transactions that happened in 2021, and the pipeline for 2022 is strong, and we expect more consolidation to happen next year and in the foreseeable future. But have to walk through some of the transactions just from a high level, if that would be helpful.
Sure. Yeah. Fill us in.
Yeah. So a few notable transactions were Ontario Teachers' acquisition of Acorn. Ontario Teachers is a Canadian pension fund with over $20 billion of assets under management, has had a ton of success in the healthcare services space and multi-site consumer space as well. And they partnered with Acorn in the summer of 2021 and are a great partner for that business and a great investor to have in the space.
Yeah, and I was going to say, and Vicky Kroviak, that CEO, is fantastic. She is just an incredible leader. They're BHCOE accredited, so we know them pretty well. And that's, Jon, I think the third Canadian investment group that's come down to the US, right? Because I know Imperial Capital is Canada-based. We have DHW Partners. Is there anyone else that's kind of Canada-based that's investing in the US market?
I think those are the three right now within this space, but you have others such as OMERS that have a strong thesis within the behavioral space and autism in particular and are very interested in the space. But you're right, there is a lot of interest coming from north of the border and making really good partners and favorably impacting the industry for sure.
Great. What else did we see?
Another transaction that I think was noteworthy was Elemy. You had another example of a very large, smart investor betting on the space, and that being SoftBank. With a little different approach, I think their thesis for this acquisition was to address the supply and demand imbalance through a tech-enabled platform, which is somewhat unique. And so they paid supposedly a big number for that business and have strong confidence in their ability to help affect change largely through technology-driven care.
So everyone is talking about the first unicorn valuation in the industry. And for those of you who aren't familiar, unicorn valuation just means valued at $1 billion. And I think everyone's kind of scratching their heads and wondering what goes into a valuation of that type, especially considering the fact that you have the larger organizations who've sold in the past are well below that $1 billion valuation, even though they've been in the market for decades. And then you have Elemy, who's kind of a couple years in, is getting this crazy valuation. What goes into that, Jon?
Yeah, so, I think if you look at the type of investors that sponsored that deal, they're not your traditional private equity firms. They're more of venture capitalists that underwrite primarily technology-driven businesses. And so I think got a lot of press because of that. And I think their approach is somewhat differentiated to try to take the services that you could address through technology and deliver them virtually, whether it's parent training or child monitoring. I think they and most people would agree that most of the services within autism in the provision of ABA are delivered in person, whether it's working with skills acquisition, data collection, and others. And so I think their blended approach is something that they think is a little bit differentiated. And when you look at the wait list and the supply and demand imbalance in the space, I think that they're thinking that they can address that through technologies, through virtual care, as opposed to delivering in-person care. And I think the results for that, their ability to do that, and the resulting impact on clinical outcomes will remain to be seen.
That's a huge impact for organizations who are thinking about how heavily to invest in telehealth. And I'm curious, is that something that you're noticing as we go into the new year, as companies prepare to go on the market, whether they have to showcase the viability of care they're providing via telehealth?
I think one of the positives to come out of the pandemic is that, and as you know, Sara, that commercial insurers, all of the providers have been for years trying to get insurance companies to reimburse for telehealth and hadn't had much success until the pandemic materialized in 2020. And so I think it's a good way to, again, address that supply and demand imbalance, treat children in areas such as rural places that otherwise wouldn't be able to be seen in person, train parents, and do parts of the care that you can through virtual care. But I still think that most people will agree that in-person direct care, something that's needed for this patient population. But to your point, I think most providers now have those telehealth competencies and capabilities and are providing them, A, to get through COVID, but also to help address patients that otherwise couldn't be seen in person.
Yeah, I can completely agree with all of that. I was just thinking in like 2018, 2019, even beginning of 2020, you had like Florida Autism Center, which is 100% center-based. And you have these other platforms that are just fully center-based that are thriving. And that FAC acquisition happened right before COVID hit, right? And was, I'm sure, greatly impacted like everyone else was. And then now, fast forward 2021, 22, there's that movement to no center-based at all and telehealth. And then an additional component that's everyone looking at what is the technology behind what you're using too, not just the actual humans as the kind of conduit to therapy. So are you seeing that more ABA organizations going on the market are also not just investing in the telehealth side and the people side, but also some type of technology infrastructure that can serve as a differentiator?
Yep, I think technology infrastructure is important, whether that's proprietary or third party. I'm not sure that matters that much. I think a lot of the platforms, given the attractiveness of the market, just being the size and the levels of white space and fragmentation and overall tailwinds, are focusing their resources on the provision of care as opposed to being technology companies. But I do think that the ability to manage organizations through data analytics and KPIs and be able to support clinical excellence and standardization and operational efficiencies throughout the organization is something that you need a good technology infrastructure. So I think it's important. The other thing I would say is you mentioned a deal that closed right before COVID, and another one that closed in February of 2020 was General Atlantic's acquisition of ACEs. And that business has done extremely well throughout the pandemic. And I think part of the reason why is because, and you had mentioned earlier about center-based models and home-based models, but those businesses that are more versatile, that have competencies both in the community with center-based care and home-based care, I think that model is showing a lot of traction and will become more valuable as you emerge from the pandemic, just to treat children in the best care settings possible, whether that's in the center or in the home or in the school. And so when you have that level of versatility, those models are proving to be highly resilient throughout challenges that you're facing now, not just through COVID, but also through the labor supply issues.
Absolutely. And I think a big part of investment capital coming into the space is how do we increase access to those who typically wouldn't be able to get care because it may not be as lucrative to be in certain areas. And then I think on the other side too is how do we make sure that we create a clinic environment or a therapeutic environment where based on the child's needs, we can service them in whichever way is best for that child. So I agree that limiting to just center or just home or just whatever it might be may not be the best approach from a clinical perspective. And I think ultimately standards and quality assurance is really going to make sure that these organizations continue to thrive, not just from the P&L perspective. What else did we see this year? I think there was one other transaction that I think was quite notable. Do you want to tell us a little bit about that one?
Sure. I'm not sure. Maybe you're referring to the Lighthouse transaction, but that was another noteworthy one in where you have another leading investor being Cerberus, a large one with over $55 billion in assets that entered the space. And I think if you look at Cerberus, they pride themselves in their operating capabilities to improve performance and drive long-term value. And I think with those operational competencies and rigor, they're a great investor to have within the space. And if you look at the capital that's come into the space, that's noteworthy, but I think who it's coming from is equally important. And if you look at investors like Cerberus, SoftBank, who we mentioned, Blackstone, GA, Ontario Teachers, Audex, Golden Gate, Griffin, FFL, these are all thematic investors with a ton of success in healthcare services and multi-site consumer businesses. And while the industry is still nascent, you can see the positive changes that are starting to materialize throughout the market by them helping professionalize the industry through infrastructure investment, as you had said, to increase access to care and to improve clinical outcomes. And alongside of that, you have accrediting organizations like BHCOE who are focused on clinical excellence and standardization to help improve outcomes and clinical results. And that's also tremendously benefiting the market. So there's a lot of things going on. And when you have a space that, like the autism space, that's so big and has so many different tailwinds and white space and fragmentation, there's room for multiple winners within the space. And those winners, this is a space where there's strong correlation between clinical and financial outcomes. So you have full alignment between the industry and the investors. And it's a space that's big enough for multiple parties to benefit both the industry and the LPs that are backing the sponsors that are entering the space.
Absolutely. I couldn't agree more. And I think the other piece on it is I think about all the lobbying that's going on, all those backers that you mentioned. Think about how much money is going towards lobbying for better rates, better care, better legislation that increases access. Those are things that oftentimes is really out of reach for smaller providers unless they've scaled significantly. So it's really great to see how much effort is being put into some of these legislative and kind of policy related issues on the federal and state level. Just because we did talk about Lighthouse, and I think the question is kind of burning on everyone's mind is leading into the pandemic, the multiples were quite high in the sense that you had some PE firms that were just walking away saying, you know what, I just can't stomach this. The multiples are too crazy. How have we seen that balance out during COVID? And are those multiples still where they were pre-pandemic?
Yeah, so it's a good question that a lot of people ask. And the multiples through the pandemic have been supported and will likely be supported throughout the foreseeable future. And I think there's a couple of reasons why is one, everyone talks about the supply and demand imbalance of capital and dry powder that private equity has and a scarcity value of assets to deploy that capital into. And then going back to the market characteristics that we've discussed a few times, you have probably north of $100 billion total addressable market with highly differentiated levels of white space and fragmentation and tailwinds that we discussed, which are unique not just domestically, but throughout the world, right? And so you have the ability to deploy capital in the space and with the right focus and operational rigor, really favorably impact the business and earn a good return in doing so. And if you look at all of those investors that we touched on earlier, they're all growth investors looking to the future, and their ability to and confidence in taking that operational expertise and infrastructure investment that they've demonstrated in the past to bring to bear to this industry enables them to pay a multiple that you traditionally don't see in other more mature markets. And so in this year, I think the multiples were supported from where they were previously, and going into 2022, we have a high level of confidence that will continue to happen going forward.
And would you say that the higher valuations from years past were really based on an organization's ability to open up new clinics and onboard new patients, or opening up new locations or expanding and getting those clinics or sites up and running, whereas today's valuation is based on the ability to recruit and onboard staff at a certain frequency or at a certain speed, just considering some of the supply and demand constraints? Are investors focused more on one versus the other? Are they looking at both of them? How do those both play into an organization's ability to scale?
Yeah, so I think they're all important. I think they always have been important. To the latter point on the ability to recruit and retain professionals in industry where there is a significant supply and demand imbalance. While it was always important, it's probably more so important now given some of the labor supply issues that you're seeing across the economy. But again, it's a sector where there's multiple attractive growth levers, whether it's on the de novo side and building out a business organically, or through an M&A into supplementing your organic growth and integrating add-on acquisitions to gain provider census, patient census, and commercial insurance relationships. I think all of those things still matter. And in the past, while there was a supply and demand imbalance, but not the labor issues that you're having across the markets today, that's probably more of a focus in meeting the demand for care. But I think it's the same type of things that investors have been focused on historically. It's great leadership teams, focus on clinical excellence, a broad provider base, and the demonstrated ability to grow. And what you've seen with the right partnerships, you see the acceleration of that growth through limited operational infrastructure investment and focus on managing a business to relevant KPIs in order to scale.
Thank you so much, Jon. We're going to be talking about this and so much more at the Autism Investor Summit coming up here in a couple months. So can't wait to continue the discussion, Jon. Thank you so much for your time, for coming on and sharing your knowledge and expertise with us, and hope to have you back for our next private equity segment.
Of course. Thank you, Sara.
That's it for today's episode of The Skinner Report. By allowing yourself to be inspired and educated through this podcast, you are now one step closer to growing, building, or starting your own ABA practice that can impact the behavioral landscape. Continue nourishing your heart and mind right here by listening to more of our episodes at bhcoe.org. Be sure to subscribe to the show and leave a positive rating. Let us make the ABA scene safer, more caring, and more connected than ever before. Thank you for joining us. See you on the next one.